Hi, my name is John Rowan. I'm the National President of Vietnam Veterans of America, and I'm from New York City.
Great. So we wanted to talk to you today about the second annual Time Out for Veterans Health event. What have you seen today so far, and really, what do you think is the importance of the event today?
Well, I think it's great. I mean, we've even expanded apparently on some of the testing that we had from last time, which is great. We cover even more areas of health issues. And this is so important for veterans to come down and get tested. One of the things that's become more knowledgeable to us in the veterans field is that more veterans are affected by toxic exposure than bombs and bullets. Most veterans assumed that just because they walked off the field of battle in one piece that they were done. And unfortunately, many years later, we're coming back and finding out that we're being affected by all kinds of really nasty diseases, mostly associated with toxic exposure. In Vietnam, it was self-inflicted, unfortunately, with Agent Orange. In the Persian Gulf, it was because of all kinds of things that they don't even know for sure which one, and probably is more of a combination of things. And unfortunately, a lot of that is still lingering around even now in Iraq, and we don't know what we're going to find in Afghanistan.
Can we talk a little bit about the importance of the partnership? There's 13 of you all from the veteran service organizations, GlaxoSmithKline, the Washington Redskins, and the Health Partners. Can you talk about the partnership addressing veterans and the larger community?
Right, yeah. The key thing is getting all the veterans organizations we've got to reach out to those veterans who don't belong to us. Unfortunately, 75% of the veterans in the United States don't go to the VA for health care. They go to the private sector. And they don't belong to veterans organizations, which is too bad. And the real problem is they don't know enough about things that they ought to know about, of concerns that they need to have about what their health is going to be like. And because of their military service in particular areas and countries, or maybe even their occupation while they're in the military, may lead them to have problems later on in life that they would not necessarily presume it's related to their military service, but it is. And so we need to tell them about all of these things and need to let them know that they're entitled to compensation if they unfortunately get certain illnesses, and depending on where they served. And the real problem is, as I said, the private sector doesn't know who they are. They never ask the magic question. So one of the things we've been working with Congress in, and we're trying to work with HHS, the Health and Human Services Agency, and the federal government, who's creating this wonderful new use of technology to create a health internet network, basically. We need to get the private sector physicians to ask the magic question, are you a veteran? And depending on the answer, go from there.
Right. And so to that point, when we talk about prevention, early detection, management of chronic diseases, how important are events like this in achieving that goal to move this country more towards prevention, early detection?
Well, events like this are great because we need to educate everybody. So one of the things nice about this is now we're not only educating the veterans who come here about all of the things they need to be concerned about and need to be tested for, but we're also hopefully educating some of these healthcare providers about what the veterans need and what they need to be aware of when they see a veteran across the table from them as a patient. And so it's really working on both sides of the aisle here.
Great. And can you talk about the value of having the commitment from the Washington Redskins and GlaxoSmithKline to help make these events possible?
Oh, yeah. Without them, we couldn't get anywhere. I mean, it's really important for the corporations like GSK to come forward and help us get the word out. And, of course, an institution like the Washington Redskins to open up their facility here, and it's great. And what's really nice is to see the families come. And that's an important aspect of it, too, that they need to get the whole family behind the veteran getting their health care, particularly when we talk about mental health issues with post-traumatic stress disorder and TBI, perhaps. It's important for the whole family to understand what the veteran's going through. And it's fun to see the kids running around. They're having a great time.
Yeah. Well, we appreciate your partnership. Are there any final thoughts you'd like to share with us today about the event, or what things,
Well, I think the only thing we need to do is make sure, we'd love to see this happen elsewhere. It'd be nice if we could get some of the other football teams to get involved in their cities, and hopefully to get the word out. And the thing is just to get the word out and to encourage all veterans to find out as much information as they can. We have our website, veteranshealth.org, and which contains a lot of information from all the wars from Vietnam forward. And so we just hope that everybody gets a little more educated. And on an even more serious note, one of the things that's disconcerting is that the fact that, unfortunately, some veterans have already succumbed to some of these diseases. And the widows or widowers aren't aware that they're entitled to dependent indemnity compensation because the veteran died of a service-connected illness. And that's the real sad case, is that there unfortunately may be spouses out there who may be hurting financially, which could benefit from the assistance they would get from dependent indemnity compensation. So we're hoping that we can reach out to them as well. And that's why it's important the families to get around involved, so that they not only talk to the folks in their immediate family, talk to mom, talk to dad, talk to Uncle Sid, talk to whoever, so that we get the word out, so people know what it's all about.
As a member, Men's Health Network, as a member of the Veterans Health Council, is there a kind of a call to action or message you would want to share with other organizations like us about the council and about its mission?
I think the call is just get involved. I mean, one of the things that's been great with you folks in the Veterans Health Network, on your internet sites, getting the word out, having the information there available to veterans to find easily enough, and to help us do this public outreach. It's great, and the more the merrier. So any organizations wants to get involved, we certainly encourage them to come join us. We had the Veterans Health Council's nice open-ended organization. Everybody gets involved, and it's been really wonderful.
Great. Well, thank you so much for your partnership and
Thanks,
your service.
Tom.